few more points here on the thing.
Before you continue, 12 minutes.
12 minutes, okay. Okay, I'd like to clear up a couple misconceptions about the Keep Potsdam Smiling Plan. Its primary focus is to help disadvantaged community members with preventive tooth decay. Keep Potsdam Smiling Plan recognizes a community need, and it should also have a community solution. The Keep Potsdam Smiling Plan supports and bolsters the pro-fluoride group, the pro-clean water group simultaneously. That's very important. And it treats everybody, all voluntary qualifying persons, equally. Here's a quick comparison snapshot between what you have now and what we're proposing. You have a serves village and town versus village only, 90% efficient delivery versus 99% wasteful in delivery. Helps disadvantaged directly, or a hit or miss strategy. That's what you're choosing on. Environmentally friendly versus environmental concerns. Has an educational component, which Keep Smiling Potsdam Plan does. The other has no educational component to it. One has high accountability, the other has practically none. One heals a community and the other divides. The current fluoridated water program is 99% wasteful in delivery. Money spent on enhancing dental health is flushed down the drain and is never used for its intended purpose. According to Potsdam's engineering report, 3.8 gallons are pumped a day, or 1,387 gallons yearly. At $4.99 a gallon from Slack Chemical in Carthage, that's $6,921.13, or $18.96 a day. Does not include administrative, health and safety, labor, blah, blah, blah costs. Looking down further on the screen, we have a 10-year cost for just the chemical fluoride of $69,211 and change. Over 99% of that fluoridated water is not consumed for dental health. Therefore, $68,519.18 of your money is sent down the drain, never reaching its intended purpose as waste. Ingestion benefit. Keep Smiling Potsdam provides controlled dosage of pharmaceutical grade fluoride, that's important, tablets to those who need it. Municipal water provides random dosage, some drink, no water, others a lot. Combined with the necessary dental evaluation, dental tools provided, and the oral hygiene educational benefits, the program is far more comprehensive. 99% waste overview, in case you're wondering how we got this. This gives the best case scenario leaned towards the municipal fluoridation water side. What does that mean? 9,700 people are served according to the Potsdam report. At a 100% participation rate, which is what everybody hopes for, we said, let's give all 9,700 people 1 gallon of water to drink a day. That would be pretty hard to do. In fact, if you use the analogy of half your weight in ounces, a gallon is 128 ounces, therefore you'd have to weigh 256 pounds to meet that criteria. So this is heavily weighed in favor of the municipal system. If everybody did, in fact, consume 1 gallon of water, that would be 9,700 gallons, which is a tiny statistical blip in the grand scheme of 1.06 million gallons pumped a day. That's not even a statistical measure. It's almost nothing. That much, 1.05 million gallons, as far as dental health is concerned, is flushed right down the drain. It never meets its intended target. We want community support. Let me give the following analogy. What would happen if one collected funds for UNICEF and then took less than 1% of the proceeds and distributed it to the truly needy, then distributed some to those who don't want it, then distributed to some who really didn't need it, for example, elderly with dentures, etc. Then took the overwhelming 99% of all the funds and discharged it down the Racquette River. Using that analogy, how long would UNICEF or an equivalent program last if it was run in this fashion? Would this stand as a sound business model anywhere that you can think of? This is the current distribution of fluoride in the municipal water system that we have right now, and why the new Keep Potsdam Smiling Plan helps effectively eliminate such wasteful and ineffective practice. People tend to feel much better about supporting a program that actually does what it's designed to do, provide dental health benefits, and Keep Potsdam Smiling Plan does this very, very well. In summation, The Keep Potsdam Smiling plan does not eliminate the use of fluoride. It merely distributes it in a more responsible, safe, and substantially less wasteful manner than the current system. The Keep Potsdam Smiling directly addresses the disadvantage with tooth decay prevention, gives back clean water to everyone, and relieves the municipality from the responsibility of dealing with all of this, something that may have been convenient decades ago, but cannot address the issue as comprehensively as Keep Potsdam Smiling does. The Keep Potsdam Smiling promotes all sides of the discussion. Some wish to make fluoride an either-or proposition. This is not the case. The Keep Potsdam Smiling plan is the only smart and viable solution that effectively addresses the disadvantage both in the village and the entire town. Its forward thinking also promotes the county's fluoride varnish program that looms on the horizon. It serves the community better by serving the entire community, addressing a community-wide problem. And that's it. Thank you very much.
Mr. Butler, thank you very much. Casey, put the lights on. Thank you. Okay, with that, we will continue on with public comments. As before, a couple times. When recognized, please go to the podium, state your name, address, address the board. You have 3 minutes. No questions or answers, no discussion with boards, no participation with the audience at all. Address us only, and we're here to listen. Who's first? Show of hands. Go to the podium, please.
Hi everyone, I'm David Bass. I'm a cardiologist. I recently came here to Potsdam. Okay, sorry. I recently came here to Potsdam, and I just want to say thank you so much for having me here at your meeting and in your town in general. My purpose, along with my colleagues over at CPH, is to promote good health whichever way we possibly can. And I was asked to come by and just give my 2 cents with regards to my personal, with regards to my field, which is cardiovascular disease. You know, what does fluoride have to do with that? Seemingly nothing, right? But actually, good dental health is extremely important for cardiovascular disease, for the individual and for the community as well. Actually, dental caries have been linked to accelerated atherosclerosis, or narrowing of the arteries of the heart, which is already something that is a huge burden. And I've already sensed it here, that it's something that is a burden to our town, to our society here in the northern country, as it is worldwide, but certainly here is no exception. And the other thing is, you know, a disease folks may have heard of called infective endocarditis. You know, it's just a nightmarish thing with a very high mortality rate, and dental caries are really oftentimes the culprit for it. And it can happen to anyone at any age. It's oftentimes folks that didn't really, you know, have other reasons to have infective endocarditis. One of the sort of developing reasons these days for it is IV drug abuse, but a lot of times folks with dental caries who just don't have good dental care, they end up succumbing to this disease with a very high mortality rate. So, you know, I think if there's my 2 cents, you know, I'm not an oral surgeon or a dentist, but I do believe in obtaining expert opinions on these things, and we have a system in place that provides a necessary element, a necessary mineral to promoting everyone's dental health, and it's been a proven method to work, and it's been doing its job for a long time. I would just ask that we consider that the alternative approach doesn't have sufficient sort of data, if you will, or sufficient proof that this alternative method can provide the same health to our community, to our kids, to our elderly as well, to our middle-aged folks, and everybody in between, if it doesn't have the necessary data to say head to head, well, listen, I have a better approach and I can prove it, then maybe we should be reluctant to do away with something that seems to be doing a decent job. Thank you so much.
Thank you. Who is next? And please, 3 minutes.
Hi everyone, my name is Dr. Hamza Malik. I am a neurologist. I live at 322 Baghdad Road in Potsdam. I just want to give my 2 cents. So I know with the whole fluoride debate, there's a lot of concern about neurologic disease or impact to nerves, to the brain. And I just want to reassure everyone that the amount of fluoride that's in the water, that we've been putting in the water, is safe from a neurologic perspective. People saying fluoride is a toxin, if you think about it, literally everything is a toxin. Pure water is a toxin. You can become a quadriplegic, inability to move if you drink too much water. You can have what we call a locked-in state. Magnesium is a toxin. Vitamin B6 is a toxin, calcium is a toxin, but we don't tell people not to take these things. Fluoridation is a known method to make sure people don't get dental disease. It's proven, it helps, it's safe, and as we know, it prevents infective endocarditis, which I'm biased toward the brain. It can go to the brain. Whenever you have an infected heart, that bacteria can go to the brain, and that can cause death. We just want to reassure everyone that there is the levels of fluoride that we have in the water. There is no concerns from a neurologic perspective of causing any nerve disease, nerve damage, IQ changes, things people are concerned about. The levels that we have, that's not true. Thank you.
Thank you. Who's next?
My name is Kathleen Terrence. I'm a pediatrician. I work in Canton. I teach also at Canton Potsdam Hospital. And I take care of children in many of the surrounding communities. I see a large burden of dental disease in our patients. I take care of kids who have to suffer with the pain of cavities, the pain of going through dental procedures, often traveling long distances to have those taken care of. I've seen kids who've had neck abscesses, facial abscesses, all related to dental decay and disease. And I am concerned that the Village of Potsdam is considering taking away a proven strategy for prevention of dental caries, not only in children but in adults, and taking that away. And the children who don't live in the village, if they drink from the water fountain at the school, if they fill their water bottles, they will be at least getting some. So I don't think this is necessarily a completely differential treatment. And so I am concerned that we will see an increase in these outcomes, more cavities, more abscesses, more suffering. And so I think that this group should consider whether they would like to take a proven strategy that's been also shown to be safe for both children and adults, and is used in the vast majority of municipal water supplies in the country as a prevention strategy for caries, and take that away from the children of the community and away from the rest of the community in weighing out claims that don't have real scientific backing, at least in terms of the medical literature, at least in terms of the public health literature that's out there. So I think that at this point, they should move forward with continuing this program that has been helping children in this community for years, and we shouldn't move backwards and wait and see what happens for those children.
Folks, if you will just indulge me and hold your applause, you need till the end, in the essence of time. Thank you very much. Who's next?
My name is Ayal Kadar. I'm the one rheumatologist in the county. I live in the village on Florence Avenue at 36. So I've already addressed everyone before, and I've mentioned my own personal story of having spent 2 years in a country without fluoride in the water. I never had tooth decay before and developed significant tooth decay during those 2 years. I never had any since. I want to talk today about, kind of follow up on what some of my physician colleagues have talked about, the role of chronic inflammation and why it's such a serious public health issue today, and the link between chronic inflammation and periodontal disease. When you have tooth decay, chronic gingivitis, you have a chronic inflammatory state. You can look at many studies that have linked chronic periodontitis to elevated levels of blood test called the C-reactive protein, which is a general marker of inflammation. And we already know that chronic inflammation leads to higher risks of coronary artery disease, stroke, rheumatoid arthritis, infective endocarditis, just to name a few. One of the key diseases that I see as a rheumatologist is rheumatoid arthritis. It's a very high morbidity and mortality disease. It shouldn't be named rheumatoid arthritis. It should be named systemic rheumatism. It affects any organ in the body potentially. 1 in 10 patients has lung disease from it. It can affect the eyes, the heart, the kidneys, the skin, anything. And the risk of coronary artery disease is significantly elevated in an RA patient. And one of the two major known risk factors for developing RA is periodontal disease. The other is smoking. Those are the 2 controllable risk factors we have. We can't control our genes, but we can not smoke and we can keep our oral health good. And those are the 2 best ways to prevent RA. I want to, in the little time I have left, also just call attention to everyone to one of the major studies that was done in the last year. It was called the CANTOS trial. You can all look it up, C-A-N-T-O-S. 10,000 patients, published in the New England Journal of Medicine, a randomized, controlled, double-blind trial involving a medicine called Ilaris against placebo. Ilaris basically brought down the CRP levels. It's what it does. It's a blocker of a thing called IL-1. It brings down that inflammation I was talking about. That group that got the Ilaris had a markedly reduced risk of stroke and heart disease. It was one of the biggest, most important papers of the last year. This is independent of your cholesterol level. So you can have perfectly good cholesterol and a sick mouth, and then be at significantly increased risk for a whole bunch of chronic diseases. And so I want to just make the point, and I'll end with this, that chronic periodontitis and tooth decay equals chronic inflammation, equals a chronically increased risk of multiple diseases for our adults and for our children. And I think it's essential to, when making the decision that you make today, just weigh the evidence we have for fluoride against what we have against it. I've been a rheumatologist for quite a while. I've seen over 20,000 patients. I've never seen one case of skeletal fluorosis. And when it does hit, it tends to be very mild. So thank you.
Thank you. Next.
Hi, I'm Daniel Solon, the infectious disease doctor here at Town of Potsdam Hospital. Live in Canton, but work in the hospital, which is in Potsdam, so I spent half my life there, basically. The biggest question we always ask when dealing with infections is kind of like, what can we do to prevent this? Whether it's a condom use for STI, not using IV drugs. In this case, you want fluoride to help harden your teeth and prevent the actual decay of the tooth. The decay of the tooth leads to all these extra bacteria that are in your mouth anyways, direct access to your blood. We can go on and on about all the different kinds of infections you get, whether it's Lemire syndrome, Ludwig's angina, bacterial endocarditis, brain abscess. It all comes down to that kind of root cause, and that's preventing decay. The decades of research that have gone into the fluoridation of the water without really significant side effects or adverse effects is staggering. And it goes back to the, in my mind, similar to the anti-vaccination kind of thoughts, where they'll get the study and they'll twist the findings to kind of cherry pick their own way of presenting this information. But when you go back and look at it, it really does not hold up underneath close scrutiny and a peer review analysis. So whether it's vaccines or fluoridating water, the best medicine is preventative. So I really recommend that we continue to keep going with the fluoridation of water.
Thank you. Who's next?
My name is Florence Vero. I live on Baghdad Road in the town of Potsdam. I've been a family physician in Canton for going on 13 years. I would like to support everything that my very highly esteemed colleagues have said. I do believe that fluoride does help prevent dental decay. But I also wanted to talk to you about what I know as a practicing primary care physician in Canton. I know that my patients are loved by their parents. I know that I prescribe them fluoride tablets, fluoride drops. And I know that parents that, although they love their children very much, do not pick up the prescription is not covered by their insurance, they forget to give the medication to the children. So the alternative of tablets and other supplementation may seem like a very good idea, but the amount of fluoride that's actually delivered to the population that needs it will dramatically go down, and I strongly urge you to continue it in the municipal water supply.
Thank you.
Good evening. I'm not going to repeat what I said at the beginning, but I'm Steve Jennings. My address is 219 Green Street, Watertown, New York. I work for the health department down there but lead a 4-county oral health coalition called Keep the North Country Smiling, which covers St. Lawrence, Lewis, Jefferson, and Oswego counties. I'm a member of the New York State Oral Health Coalition. I'm on their steering committee. I'm a member of NYSACHA, which is the State Association of County Health Officials, and also the Perinatal Council, which is the maternal child health network that covers this county. And all of those organizations support community water fluoridation. And we support it because it's the #1 childhood disease in the United States, New York State, the North Country, and St. Lawrence County is tooth decay. And we've all formed a coalition to work on this issue because it's so pervasive in this region. And the key pillar of our work is community water fluoridation. We don't want it to go away, we want to expand it. And so, you know, we support policy is very hard. I've actually sat in a seat like yours in City Watertown, and I know it's not fun when the room fills up, and decisions are hard, but I implore you to make the right decision, I feel, to continue this policy of fluoridating the water.